Hey, welcome back to Healthcare Consumers and Radio. This is Doug Field along with my co-host Ron Bachman. And we have joining us today Tom Wicka, CEO of Novu, which is a new innovative online consumer health engagement and rewards platform. Tom, good morning.
Hey, good morning. Thank you, Ron and Doug, for allowing me to join you.
Yeah, nice to have you. You coming to us from cold Minneapolis, correct?
It's as bad as winter as I remember in 30 years. So we're this week we actually we hit 40 for the first time since November. So we're happy to be out of the polar vortex, at least temporarily.
But still doing ice fishing, I think, right?
Oh God, yeah, hell, we might be ice fishing in June at this rate. We'd love to have you guys out sometime.
Yeah, we get up there quite a bit, so look forward to having an opportunity to meet with you when we get up there next. Tell our audience what you're doing.
So Novu is, as you mentioned, we really kind of we position ourselves as consumer health engagement, which is a little different than wellness. And I say that because I think in a lot of your content, the program is really geared towards the employer space, which we're very much interested in. But we really stepped back and built for the individual. And so our background is where we came from was loyalty, building loyalty programs and managing loyalty programs for airline industry, hospitality, retail, and brought that approach to the healthcare sector with this idea that, frequency really does matter. And, of course, everyone has wellness and says, here's our results, but at the interim steps that happen before outcomes, of course, is real engagement, and frequency of engagement really matters. And so this idea of Novu is really built for the individual, for you, Doug, or you, Ron, to adopt what you want to do, what's important for you. And, we've said it before, when the individual makes the decision to change, that's when it's going to change. The next most influential person is the physician, and after that it drops off pretty quick. Even financial often doesn't get it done. So Novu's approach is to build something that I really want to use every single day, that I really want to help. I want to make it mine. It's not you giving it to me and requiring it to me with the finger wagging, but it really allows me to make the decisions on a daily basis to improve my overall healthy lifestyle. And lifestyle is not strictly defined as I eat well and I ran 30 minutes today. It's a broader, how's my sleep going? How am I feeling about stress, financial situation? So it tends to have kind of a big tent approach. So in a few sentences, that's how we position ourselves. A little different than the marketplace, but certainly in the category of consumer health engagement.
So what's your target? I know you built it for the individuals. Are you working with health plans and employers? What's your target?
Yep, a great question. I think we believe our differentiation is really with providers and the payers. So the health plans and then the caregivers or the providers. And I say that because we also have a strong belief that with the healthcare challenges aren't really brought on by the millennials. If anything, right, in ACA, they're required to make the boat work. But it's really with people with chronics or the senior category or people that are more health challenged. And so we try to position ourselves payer-provider as really our best channel, our distribution, and even going into categories that, tend to be not as populated with wellness. As one of our leading products and probably our greatest success has been in the Medicare space. And that really is where a consumer, right? They buy individual, they switch out every year, or they have the opportunity to switch out, and it's an individual decision. And so that would be a good example how we're really working with the payer space in trying to differentiate ourselves in markets like a Medicare space, which has generally been underserved.
What's your business model, Tom?
It's a digital platform, so it's a digital platform that we offer to the populations, and we include rewards. We obviously include all the health elements of as well in the platform. We could turn modules on and off based on customer need and what level of exposure they want for the different products within the platform. But it's as you guys know, the space has largely been built on a PM population. Right. We take a little bit different twist in that. We try to work on a set licensing fee, and we try not to let drill down to the individual engaged or unengaged. Try to make it very affordable through a master license to a set population, and then work collectively with that organization to drive up engagement. So our model, right, as engagement goes up, your costs don't go up. And so the incentive is we're aligned with our partner to drive engagement as high as possible. There's no incremental cost. You mentioned in the opening comment we have an innovative rewards platform. Our kind of out-of-the-box rewards platform is completely funded by Novu. So your subscription or your license with us funds our rewards. And that comes from our background in loyalty as airlines, where we thought really of, I think, elegant ways to bring rewards, intrinsic, but real meaningful ones. But there's no back funding to that. So the payer or the provider or the employer, sometimes I don't know if you've ever heard, is I can't afford for my rewards or my wellness program to work too well. And in our model, there's really no funding required past the initial licensing or the subscription fee that we do up front.
Tom, it's Ron Bachman here. You talked about the whole idea of engagement. I think that's a great space to be in right now, and I think it's a growing recognition that engagement is the real key, and how do you best engage people. You talked about engaging both the patient and the provider. How do you get the provider involved? How do you know who the patient's provider is? How does that part of your business work?
Yep. Well, I think as you said, Ron, by each category it's a little different. In working with the providers, they're really interested in the populations that they probably have some shared risk in, or they have in populations that they have a bigger dog in that fight. And so for us, it's to take parts of our platform that are more around some of the chronics, the diabetes, which is nutrition or smoking, and just general fitness is obviously something that everybody can use regardless of your condition. And with the provider usually offers that actually through the clinic, through the clinician, to the patient right there in the waiting room or in that room. Think about it. How often does the doctor say, and we know this, and I've heard you guys refer to it as, Tom, you've got to stop smoking and you got to lose 30 pounds, and I'll see you in 6 months. Right. Good luck. And you leave that, and guess what? Tom comes back, and what's changed? Maybe he had a life event that he stumbled upon, or some other interference that changed his lifestyle, but often that PCP relationship is not leveraged. So we put our platform or our tools in the hands of the provider and really at the clinician's level, and then they're able to share that and say, Tom, I asked you, I'd love you to stop smoking. I'd really like you to work on your weight. Here's the platform, Novu. Let me show you how you activate. Here's what you do. Everyday rewards. You can communicate to me. There's a social aspect to it, so it really wraps around the individual. And, of course, it's not perfect, right, guys? Otherwise, we've taken time to spend time with you. I'd be so successful I wouldn't even have time. But it's not a perfect platform. But this idea of patient engagement is obviously so needed, yet it's always talked about. How do you do it? And we're actually putting devices and our platform in patients' hands, and then they're interacting with the clinician at a really one-to-one level. Allows that clinician to manage multiple thousand patients at a more intimate level, not having to see one of them every single day, which obviously, A, economically doesn't work, and B, logistically just can't happen.
So just to be clear for our audience out there, are you selling this directly to individual physicians, networks of physicians, physician associations as a tool that they can use as follow-up with their patients? Is that what I'm hearing?
Yeah, our distribution right now to the clinician is through their provider network.
Right.
So it'd be one step up from that, and then bring it down to the clinicians. And it's not that we're opposed or couldn't do that more of a very specific, but starting at a bigger relationship, because as you know, organizations need to adopt. They're going to get behind a strategy and really support it. But often it starts with a few clinics are carved out of a bigger network, and that's where the initial work is done. And how do we best roll this out, and then we expand from there.
Tom, how long have you been in the market? When did you roll this out with your first clients?
Yeah, the product's been products in the marketplace for just about 14 months now.
Okay.
Obviously, we were working ahead of that for the first product release or the platform release, but it's been 14 or 15 months in market now.
And you've added some interesting tools for that millennial group, which you said may not need as much as some of the older chronic and persistent cases, but it's the well that we want to keep well so that they don't get into those chronic cases and sickness status. You build in some gamification. Tell us about that. That seems to be another new term developing out there, especially targeted towards the millennials.
Yep, that's right. And there's a few, and you're right, that is an area of importance because we got to keep them healthy and on the right side of the fence, if you will. So the idea of gamification, as you said, is a popular term, or you're hearing it more and more, and there's a lot of ways to apply it. But fundamentally, people don't like playing games necessarily because they're just fun. There's innately this idea of competition and challenge, and can I do better? And so and that's ingrained in everybody. Certainly some people have it more in their DNA than others, but it's really fundamentally part of us. And so we want to certainly leverage that challenge that I want to do better, I want to compete, I want to see if I can improve on the health side. And so the two ways that we really expose it to the member is through our group challenges and our individual challenges. And again, that's not right. I've heard people on your show that have that a part of their platform. Mm-hmm. And then a part of our rewards platform. So what we are able to do, right, is be able to complete a number of tasks through a challenge in sequence and make that part of a broader mission, or get to a very specified goal, and then rewards are granted. Rewards sometimes can be, as I said, could be some monetary in some cases, or often they're digital or other notifications of your success. Badges are very common. I don't know if you're familiar with that term, or where you're actually earning kind of digital credentials so you can see and show others as they look at your profile of what you've been able to accomplish. It allows the individual to compete with him or herself. It also then a very nice and an easy platform where groups, companies, individuals can form teams and then participate in the challenges and earn rewards or earn their badges or their digital credentials in a way that that I can show in my profile and demonstrate to others and to myself that I've been successful.
Well, another area.
We use it in a combination ways of using our rewards and our challenges, but use this kind of mission-style approach to engage people to come back with frequency. As I remember in my opening comments, we think frequency really matters. If I do something 4 times a year, let's not expect a huge outcome. If I'm doing something over a longitudinal period of time frequently, the outcome is going to follow.
Hey, Tom, listen, I appreciate it, and time flies here when we're having fun. We got about 30, 45 seconds, and I want you to tell our audience how they can get in touch with you and leave them with a takeaway, if you would.
Yeah, absolutely. Appreciate that. And, again, thank you for the opportunity. I think Novu.com and just drop us a note at Novu.com, Novu.com, or I'm always happy to be spoken to directly, and mine is easy, Tom@Novu.com. It's simple. When you're founder of the company, you get to pick your own email, so that's kind of a fun thing to do. So Tom@Novu.com. And I think it just generally our approach is as truly focused at the individual and thinking about I've got to activate the individual before I can have any downstream outcomes for my business. And so we really, I think Novu takes this, as I opened my opening comments, from the loyalty space of how to get somebody in a frequent relationship. And then once in a relationship, how do I use that equity, that relationship equity, to influence their decision-making? Right. I think that's what sets Novu, I think, apart from other people in the space.
Tom, listen, I really appreciate it. Enjoy your weekend up there. Hope it warms up in Minneapolis. And come down and see us at our forum, May 7th, 9th here in Atlanta. Would love to have you join us down here. And
well, I'm going to look into it. And as you said, as you get up here, please reach out. We'd love to connect.
Will do. And
all right, Best. Thanks for having me.
Thank you, Tom. And to our audience, thanks for joining us today, and we'll see you next week on Healthcare Consumerism Radio.